Welcome to our channel Family Wisdom that offers science-backed, practical, and workable solutions to day-to-day family issues.
Here is the science-backed, well-researched clinical roadmap to rebuild trust in a relationship. Trust is the positive expectation that the person we love will act with integrity, care, and reliability over time. When trust is broken, the impact goes far beyond disappointment. It destabilizes the emotional and physiological foundation of a relationship, often creating symptoms similar to trauma. After betrayal, deception, or repeated dishonesty, the nervous system enters a state of hypervigilance. Thoughts race. Safety feels uncertain. Even ordinary moments can trigger fear or suspicion. Many couples describe this period as emotionally exhausting and deeply confusing. Rebuilding trust is one of the most difficult processes a relationship can face. It is not quick, and it is not linear. Clinical research shows that meaningful recovery usually takes 18 to 24 months of consistent, intentional effort. Progress includes setbacks. Healing happens in waves, not straight lines. Successful trust repair rests on three foundational pillars: safety, accountability, and consistency. Safety means creating an emotional and physiological environment where the nervous system can settle. Accountability means taking full ownership of the harm caused without defensiveness or excuses. Consistency means sustaining trustworthy behavior long enough for the relationship to form a new, reliable pattern. The goal of this work is not to return to the relationship as it was before the breach. That relationship contained vulnerabilities that allowed trust to be broken. The true objective is transformation, building a stronger, more resilient bond based on transparency, emotional attunement, and mutual responsibility. The process of rebuilding trust unfolds in three phases. Phase 1: Crisis management and stabilization. The first phase focuses on stopping emotional damage and creating immediate stability. The harmful behavior that broke trust must stop completely and verifiably. Any ongoing secrecy or contact that threatens safety keeps the nervous system in survival mode. Without this first step, healing cannot begin. Betrayal creates trauma-like responses. The body reacts as if danger is ongoing. Emotional volatility, intrusive thoughts, difficulty sleeping, and heightened sensitivity are normal reactions, not signs of weakness. Stabilization involves slowing the system down. Prioritizing sleep, nourishment, grounding practices, and emotional regulation is essential. Many clinicians recommend a brief period of emotional containment before deep discussions begin, allowing both partners to regain basic stability. Clear boundaries function as protective guardrails. These may involve transparency around communication, technology use, or social interactions. Boundaries are not punishments. They are temporary safety structures that prevent further injury. Equally important is the ability to pause heated conversations without abandonment. Agreed-upon timeouts help prevent emotional escalation while maintaining connection. During this phase, responsibility is asymmetrical. The partner who broke trust carries the primary emotional burden. Apologies must be sincere, repeated, and non-defensive. Healing requires patience, not urgency, for forgiveness. A clinically effective apology includes 4 elements: acknowledging the harm, expressing genuine remorse, taking full responsibility, and committing to changed behavior. Excuses, minimization, or blame shifting undermine safety and slow recovery. Full disclosure is also necessary. The betrayed partner needs clarity to regain a sense of reality. However, disclosure should be structured and often guided by a professional. Excessive detail can re-traumatize rather than heal. Empathy is critical. The partner who caused harm must be willing to listen to pain without correcting it, explaining it away, or making it about their own discomfort. Validation allows the injured partner to feel seen and emotionally prioritized. Shame often drives the desire for quick forgiveness, but lasting change requires moving beyond shame into self-awareness. Understanding why the betrayal occurred is essential, not to justify it, but to prevent repetition. Transparency must become proactive rather than enforced. When honesty is driven only by surveillance, resentment grows and internal integrity does not develop. The goal is for honesty to come from internal commitment, supported by structured communication rather than constant monitoring. Phase 2. Behavioral transformation and systemic repair. In the second phase, words give way to actions. Trust is rebuilt through small, consistent behaviors repeated over time. Dramatic promises do not heal betrayal. Predictable reliability does. Consistency means showing up when promised, communicating clearly and aligning actions with words, even when no one is watching. Integrity grows in moments that are easy to overlook. Trustworthiness has 3 components: consistency, integrity, and dependability. These qualities must be demonstrated over months, sometimes years, to replace old patterns with new ones. Structured communication becomes essential during this phase. Scheduled check-ins provide a predictable space for open dialogue, reducing anxiety and the need for spontaneous interrogation. These conversations are calm, clear, and focused on emotional experience rather than accusation. Boundaries are clarified further. Non-negotiable boundaries define behaviors that would end the relationship if crossed again. Naming these boundaries helps the injured partner rebuild trust in their own judgment and sense of self-protection. Attunement deepens during this stage. Attunement means the ability to stay emotionally present with a partner's pain without becoming defensive or withdrawn. When empathy replaces self-protection, emotional safety increases. Connection rituals support systemic repair. Small, consistent routines, such as shared walks, meals without screens, or brief daily check-ins, build stability and emotional closeness. These rituals reinforce commitment through action rather than reassurance alone. Phase 3. Addressing root causes and reconnection. The final phase focuses on deeper psychological healing and the rebuilding of intimacy. Betrayal often triggers unresolved attachment wounds. Anxious partners may seek reassurance intensely, fearing abandonment. Avoidant partners may withdraw emotionally to avoid vulnerability. Disorganized attachment can create cycles of closeness and distance that feel confusing and destabilizing. Understanding these patterns allows partners to respond with compassion rather than reactivity. Healing attachment injuries often requires therapeutic support. Betrayal is rarely an isolated event. It often reflects unmet emotional needs, communication breakdowns, or unresolved personal struggles. Without addressing these root causes, trust remains fragile. Forgiveness becomes relevant in this phase. Forgiveness is an internal process. It is the release of resentment, not the erasure of memory. Reconciliation, on the other hand, is relational and depends on sustained, trustworthy behavior. Forgiveness does not mean immediate emotional relief. Emotional forgiveness unfolds gradually through repeated experiences of safety. Rebuilding intimacy requires vulnerability. The injured partner must eventually risk closeness again, and this can only happen when consistent behavior lowers the perceived risk of future harm. Emotional safety makes vulnerability possible. Non-sexual touch, open conversations about fears and desires, and gradual physical closeness help rebuild bodily trust. Healthy sexual intimacy often returns only after emotional security is restored. Professional support and long-term resilience. Trust repair is complex and emotionally demanding.
Visit again.
Professional guidance provides structure, containment, and evidence-based tools. Emotionally focused therapy helps couples identify negative interaction cycles and replace them with emotional responsiveness and security. Trauma-informed therapy supports the processing of betrayal-related stress responses. Individual therapy is often essential for both partners. Recovery typically takes 1 to 2 years. Setbacks are normal. Triggers may reappear during anniversaries or stressful periods. Having a plan for these moments prevents regression. Progress becomes visible when actions align naturally with words, defensiveness decreases, emotional intelligence increases, and both partners feel safer expressing vulnerability. Over time, couples who complete this process often develop a deeper level of transparency, emotional attunement, and resilience than they had before trust was broken. Conclusion: broken trust is devastating, but it also creates an opportunity for profound transformation. Rebuilding trust is not about forgetting the past. It is about reducing the risk of future harm through sustained, reliable action. When safety is restored, accountability is consistent, and behavior becomes predictably trustworthy, the nervous system relaxes. Emotional connection becomes possible again. Trust returns not through reassurance, but through time, integrity, and unwavering commitment. And when rebuilt properly, trust can become stronger, deeper, and more resilient than it ever was before.
Thanks for watching. Please like and subscribe. Visit again.